toes and hips right over the feet, shoulders nice and relaxed. Okay? Now remember, when we're talking about the lower back, we're talking about the pelvis, right? We're talking about the sacrum, we're talking about the lumbar vertebra, okay? The abdomen, the quads, all the muscles that attach to the pelvis. And that's basically everything that influences what happens in the lower back. So we're going to start out with a couple of exercises to just move everything around, get some blood circulating. I'm going to stand a little bit to the side here. Start with those feet apart, knees bent, shoulders relaxed. Now from here, I'm just going to practice moving my hip a little bit. Hands on my waist. I'm going to rock forward, and I'm going to rock back and lift up my chest. Rock forward and rock back. And this is just gentle. I'm not trying to force this. Just trying to get a little bit of blood circulating in the area. All right, so tilting back, opening up the chest, tilting forward, it's almost like you're crunching your stomach. Tilting back and lifting up, and then crunch your stomach. Okay, and after you do that a few times and you feel like you got a little bit of motion going, we're going to crunch the stomach forward, right? Crunch it forward, and then just tilt the hips from one side to the other. Okay, and that tilt, the tilting from side to side, right? It gently shifts the vertebra a little bit, right? And while all that little shifting and all those little turns there, they help the blood circulate through the joint spaces of the lower back. All right? So after I've done that, I'm going to circle around, keep the knees slightly bent, just circle around. And as I circle around, make sure and turn the hip forward, right? As opposed to just circling and I'm just moving my knees now. I want to circle and rock the hip forward, see, rock it back, rock it forward, rock it back, and go the other way, rock it forward and back, right? Now, it's important to see what's happening. I'm really emphasizing the pelvis rolling forward and the pelvis rolling back, okay? Because that's actually creating circulation. If I just circle my whole body around, that's okay, but it's actually my knees and my ankles that are moving more than anything else, right? When you can see it here, it's more like doing like a hula hoop motion. Okay, so after you get a little bit of warmth on that, I'm going to take the hands right below the belly button, right where the lower dantian is, and I'm just going to rub from side to side. Now, as you see, as I'm rubbing from side to side, I'm not turning the knees at all, right? I'm not like turning the knees because I'm focusing, right, on rotating, okay? I wear this tight shirt. You actually shouldn't wear tight clothes aren't the best for doing Qigong, but I'm wearing this so you can see the movement of the torso. So this is really important. See the hips, right? The gray versus the black, and you can see the black's moving, right? Whereas the gray part, where my hips are, is not moving too much. And that rotates, right? That's creating that nice little rotation in the lower back and the sacrum and the lower spine. So, right, to make that easier, I'm putting my hands right on the lower dantian, below the belly button, and I'm rotating around. Right? And now I'm getting a little bit of blood flowing in that area. Okay, it's nice and easy. I'm not forcing it, just nice and relaxed. Okay? And once I feel that that's nice and warm, I'm going to relax the arms. Right? And after with the arms relaxed, I'm going to circle up and down, right? Rise up and rise down. And what the hand motion does is it influences the position of the pelvis. Because this is all about getting the pelvis to move. Right? The pelvis, the sacrum, and the lower back. Because when you can get that to move, you get the blood circulating through it. With blood circulation, you get rid of swelling, and you can bring new blood in so they can repair damaged tissues. Right? Circling around, we can add a breath in there, breathing in and out. Nice breath in and out. Okay. And continuing, hands in front and then hands behind. Okay, so what's happening? Rising up and relaxing, sinking down. Rising up, sinking behind. So as I sink in front, it actually rocks the pelvis forward. It actually tilts it forward. And I rise up and sink back again. And as I do that, it actually gently and gradually shifts the position of the sacrum. And this is an open and closing motion. Right? Open and close. Just trying to get the motion of the pelvis, get the lower back moving. Okay? After I do this a few times, I'm going to take one of my feet, I'm going to take my right foot, step forward, hands right to level of the waist, and just circle the hands around, rock forward and back. Now the feet themselves, they're still about shoulder width, and you just stand, you're putting the feet in a comfortable posture, okay? As I'm rocking hips around, right? Circulating the energy, circulating the blood. Okay, I'll do the same with the other side. Other leg in front, forward and back. And just walking the weight. You can come up on your heel if you want. Just keep it nice and easy. And everything's really relaxed. There's no tension in the body. Just trying to suggest that the body moves, the lower back moves, getting the blood through there. Okay, relaxing that. Coming back to the center. Take my hands and I'm going to rock from one side all the way to the other side. So just gently bending that knee, I'm not going low, and as if I'm pushing someone over my leg. And as you turn, so you really want to gently pull the shoulder back so you get a little bit of a low back rotation. Nice and easy, nice and easy. Right? See how the knee stays somewhat bent. Everything's relaxed, there's no strain. Just trying to get circulation. Okay, do that a few more times. I feel like I'm done. And come back to the center. Circle the hands around. And then when I'm finished, I'll reach up high and sink down. And that's a really simple little routine that you can do to help circulate energy and repair your lower